Okay, so could you explain this again?
What did you want me to explain?
I was talking about how it might not be sanitary coming in, putting on gloves, typing on the keyboard with those gloves, and then working on my IV. And you were saying that that's the way to do it.
Okay, so it's the standard of care is for the nurse to wash her hands outside the room,
Okay.
put on a gown and gloves, come in because you're carrying something called MRSA.
Okay.
Okay, and it is appropriate at that time to type on the keyboard and work on the IV system. If they're changing the IV or changing a bandage, then they put on a sterile glove.
But they don't. They've never done that.
Well, when they're
They've never
changing the
changed
actual
their gloves.
line, your line isn't getting changed. When they put that line in, then they're all sterile.
Yeah, but they unhook that every time something's done, and then they replug it back in without ever changing their gloves.
That's appropriate.
That's appropriate. That's how it should be done.
Yep, that is appropriate nursing care.
So you're saying the gloves are not to protect me at all. They're just to protect you
They're to
and other patients.
Other patients primarily, yeah.
Not
because
to
you're
protect
carrying
me.
a resistant organism.
Okay.
Yeah, if you didn't have that resistant organism,
You wouldn't even wear gloves then. We wouldn't need them.
We wouldn't wear gloves when we come in here and we type on the keyboard or the things like that. We do
Or
put on
do my
gloves.
IV.
Well, when we change your IV line, we put on sterile gloves.
Okay.
Yeah, it's a different glove. These are not sterile. These are just purple gloves.
So where do we get the sterile gloves? Because they've never worn those when changing my IV ever.
No, when they're actually changing the actual line.
Yeah, when they unplug it and stuff, they've never worn different gloves.
That's not changing your IV. That's just changing the tubing.
I have watched them go over to the gloves, and they have taken a glove out of there when unplugging this, and then fed this line into the glove to temporarily cap it off, and then work on whatever, and then pull it out of the glove and plug it back into me. Is that the right way? I've watched them do that.
I haven't seen. Yeah, no.
Yep, they just did that the other day.
Line out and put it into a glove.
Yeah, that's what they did. So I've watched very unsterile things happen while I've been here. So, I mean, as you know, keyboards are one of the dirtiest things there is, right? Okay, so why should they type on that and then come unplug this line and do other things to me and flushes and things like that?
Well, it's covered,
that should not be done.
It's covered with plastic. So
which is then touched all day long. That plastic does not kill anything.
No, but it can be washed periodically.
But it's never been washed since I've been here for over a month.
Okay.
So, I mean, who knows the last time it's been washed?
Yeah, and I don't know anything about that. That's up to housekeeping.
Yeah, so that's just a lot of unsterile things I've noticed. I know it's nice to try to put the blame on me. The only visitors I've had, as you can check and see, is my mom. She's not been bringing me drugs. I've been here over a month. Where else would I be getting them? Wouldn't you have seen them in any of the tests that you've drawn out? I mean, no, come on. It's nice to put the blame on me, but
I'm not blaming, I'm asking if that's an issue. Because we've had three different infections now. I want to make sure that's not the source.
Yeah, okay,
So
well, it's not. You know, on the outside, using drugs every day, I've only managed to get the one infection. So now I come here and I've got two more. So I feel like you guys keep giving me stuff, and it's very upsetting.
I understand being upset, yeah.
So the blame doesn't need to go on me, but you know, I'm going to have to start calling out all these nurses who are doing unsterile things. I expect them to alcohol their hands before they come in, as they come in, put on gloves, and if you're going to use the keyboard, you're going to change your gloves again. You're going to alcohol them and change them again and then work on this. Okay. That's the only way things should be done.
You can certainly ask them to do that. Okay?
Yep.
All right. Now just to let you know the plan today, so we've drawn another culture through this line here. We want to make sure that's not infected. And then the infectious disease doctor, who's Dr. Sally Williams, will be in a little bit later. Most likely we're going to have to take that line out.
Oh my God, that's what they just did last time, and then it wasn't even infected. And then they put an IV in my arm, which wrecked my arm and inflamed my veins and did everything else. Yeah. So are we just going to go through that same thing again?
Well, hopefully you won't get inflamed veins again, but we can't make a promise. But most likely we're going to see what her opinion is. And most likely we're going to have to take that out, and exactly what you said is put in another IV line. Okay.
Can we put in some other type of a line?
Yeah, initially they'll do what we call a peripheral IV, most likely, and then we'll replace it with another one like that.
Okay, well, as you know, I don't have very many veins.
Right.
So, like, you know, as you can only run the meds through it a couple times before it wrecks my veins, that's
I know.
not a great thing to keep doing.
Right. I know, but the problem is if this does have a yeast in it, it can.
If it's in there, how to get in there?
Well, yeast is everywhere in the system, and it just gets around. And this is who we see it in people that have been on antibiotics for a long time, and you've had to be on kind of broad spectrum antibiotics for a long time. So it's killing all that normal good bacteria, and then sometimes things like yeast will come up. And so I understand your frustration with this. Yeah.
It's very frustrating. You know, on the outside, I managed to get one infection. I come in here and I've got 2 more.
And again, I understand
So
your frustration.
you come in here to blame it on me, but say that you knew for sure it wasn't me, then we'd be saying it was unsterile people, right? I mean, there's nothing more that it could be, or what?
We try to be as clean as we can. You can see you have a sterile dressing on that right now. It's all covered. You know, again, it's put under highly sterile conditions. They always use a swab on it whenever they change that tubing. They'll wash it with an alcohol. So we try our best to be sterile. Believe me.
Yeah, I don't know. I'm just noticing a lot of things. You know, I didn't go to healthcare school, but like I'm noticing things that aren't sterile at all. Like,
yeah, we talked about that.
Yeah, so you know, I didn't even have any of these wipes in here to clean anything till I asked for them yesterday. I had to ask for them so I could wipe my table off and stuff. Like, no one's ever wiped my room off with those. Like, shouldn't that be done?
It's usually done between patients when they change rooms. They wipe it off.
What about when you get a patient that's been here for over a month?
I don't know what the policy is on that, to be honest.
Okay, well, I feel like maybe there should be some, like, going over with the nurses on how to be more careful.
Sounds good.
Well, can we take a listen to you?
Sure.
Okay.
Let's take a look at his arm, too. That
Yeah.
place still looking better. It's good. You do have that palpable cord.
Is it still hurt?
Yeah, it does.
Is it getting any better? It's the
About
same.
the same. I would like to not keep getting those,
Yeah.
so if we could just not go back to that same situation would be nice.
The problem is with these antibiotics, because you had the blood infection, we have to give them through IV. If we could give it to you oral, we would, the medications. Unfortunately, that's a risk every time when you get IVs, is having
Yeah,
inflammation
sit up.
and infection.
Deep breath. Okay.
So you'll meet another ID doctor today, infectious disease.
Yeah.
Okay. And then
Okay.
she'll give us her opinion about that.
All right.
All right. Can we do anything else for you in the meantime?
That's it.
Okay.
Just try to have my nurses be a little more clean.
All right.
Okay.
We'll
Be
talk
nice.
to him.
Thanks.
Okay.
All right. Don't forget to turn your phone off.
Oh, I won't.